We're going to talk about community-based solutions tonight. And I know oftentimes we say Recovery Advocacy Project thinks and acts locally, and the purpose of your organizing team is to identify both legislative and community-based solutions. We don't always really dive deep into that, and so we're specifically talking about that tonight. And when we're talking about community-based solutions, we're just going to go through some organizing tips for community organizing. I'm going to give a couple examples of what some states are doing right now for community-based organizing. We're going to do some group work where you all are going to work with one another and act as a state team together to come up with a list of community-based solutions to a scenario that we're going to give you. And so this workshop is really about strategic thinking and coming up with strategies and plans of action inside your group, on your team tonight. And then we're going to leave some time where you all can come back to the main room and share some of the solutions that you're talking about. And so next slide. Great. We wanted to put this out there. Some of the slides, the content in the slides that I'm going to be reviewing is going to be in Google Classroom, and so it's referenced there. I pulled some of that off of the content that's going to be there. So when we're talking about community with us, with the recovery community, when we say that out loud, usually we're talking about people in recovery, family members, mental health advocates, allies, supporters of recovery, right? And so we're referencing the community at large when we're talking about that. And so when we're talking about community-based solutions, that can reference the recovery community across your state or across your community. And then other times when we're talking about community-based solutions, we are talking about geographically. You know, I think about my community, I think about my town that I live in, I think about my county, right? That more localized sort of community. And so it applies to all that we're talking about tonight. So just community organizing is a method of engaging and empowering people. And it's around shared interest or shared values, right? There's shared goals that people are invested in. And so it's rallying people and empowering people and working to help people find their spot in community organizing, whether it's having their voices heard to an elected official, or it's writing a letter in an op-ed. There are different ways to go about community organizing, and so we're going to talk a little bit about that. And so the organizers are typically people from the community or advocacy groups. So we're still letting people in tonight. Welcome, everybody. We're talking about community-based solutions tonight. So the first step, I just sorted out 6 steps to community organizing. And if we kind of keep this in mind for our workshops, our work groups later on in the night, later on in the training, this will kind of help you to come up with some solutions. And so this first step is really about it answers that question of what is the makeup of our community, right? What does the landscape look like? Who is in our community when we're talking about it? And so that can be demographic sort of information. You're really kind of looking at what is in your community, what's not in your community. That's why one of the things that we review early with people, you know, in the first class that we did was around asset mapping, where you can go and I'll just give an example for South Carolina. They did an asset map in a Google sheet, like a regular Google Excel form, and everybody went in there and they just listed all of the resources that they could think of across their state that had to do with prevention, that had to do with recovery, that had to do with harm reduction, that had to do with family support. So every time they do an action that's centered around one of those topics, they can go back and tap into some of those contacts in their asset map that they built together. It also allows you to see what's missing. Like, I know that I don't have a peer recovery center in my community. There's not one in my county, right? I know that because I'm out there in the recovery community. And so sometimes the things that are missing are pretty obvious. And so we do these listening sessions to help identify that too. The next slide there, Garrett. So that second step there is outreach to listen to people. And it answers that question, who are our people? Who are we organizing? And what do they care about? And so that's why we have listening sessions right off the bat. I know a lot of you right now have either hosted your first listening session, or you're moving on to your second or third one in some states. And so, or fourth actually, in a couple states, people are on a roll. And the reason why that piece is important is because we say this all the time. We don't want to guess what people are experiencing. We want them to tell us what's important to them. We want people in our communities to tell us what's important to them, what some of the issues are, what some of the barriers are. It helps you to identify priorities. And sorry, go back one, Garrett. Sorry. Thanks. It helps you to identify priorities. So we can do that in the group setting, but then also doing it with one-on-ones. We have a number of teams that have said, okay, you know, we hosted a listening session. There's 6 of us on the team. We had 12 to 15 people outside of our team that came to the session. Let's reach out to them personally. You know, they RSVP'd, so we have their email. And continue the conversation and really continue with their ideas. And by doing that, you are enrolling other people in the process. You're bringing them along. And then New Jersey did a post survey to identify priorities after their listening session. And so this keeps people engaged and really helps us get a better understanding of who our people are and what they care about. Next slide. And so one of the things that we see a lot of times is that, like, I have talked to mayors and I've talked to elected officials and I've talked to chiefs of police, and I've heard them say, you know, we don't know what you all want. We don't know what the recovery community wants. I think a lot of times when there's not consistent messaging and there's not consistent goals, then what we're trying to do becomes unclear, right? And so when you clarify what your goal is in the community with the community members, what are those shared goals, those shared interests that brought you together in the first place? Reiterate that. What does progress look like? What does success look like? And are we being clear in our advocacy organizing? Next slide. And so this is what I really want people to think about when you get into your groups, because we're going to give you a scenario and we're going to ask you to work with your group in breakout rooms to come up with community-based solutions based on the scenario. And so sometimes that might be organizing an event, whether it's a direct action, a town hall meeting, a training, workshops. Still letting people in. Welcome, everybody. Or that might be a letter writing campaign to decision makers, or that might be a petition of support or against something, or maybe you need to go out and build a coalition with other organizations, or there's some media sort of strategy. And so when you're in your groups, in the breakout groups, think creatively. You know, think about different things that would engage other people in what you're doing, what mobilize people and empower them. And so pick a strategy that's both, you know, manageable and impactful. It can't be like a pie in the sky sort of thing that, you know, you're never gonna get there. Let's figure out something that is reachable and strategize something that's really simple. That and sometimes it's not like not a one size fits all sort of thing, right? It's like addressing addiction is not one size fits all. Our recovery is not one size fits all. And advocacy is not one size fits all. There's a lot of different strategies that you can use and combinations of solutions that you can use to get to your goal that you clarified in step 3. Next. Great. So who's willing to do what, in terms of, some of the organizing you did in step one, right, where you went out and you identified some of the organizations, that might be, invested in what you're doing, or individuals across the state. Who's willing to do what? One of the things that you can do is partner with some other like-minded organizations or advocates across the state. Ask them what they're willing to do, whether it's sharing a Facebook post, sharing an action on their Facebook page, or it's being part of a coalition, or they want to send out an email blast. There are different levels of involvement, and so having that conversation with people, that one-on-one with people, and talking to them about the campaign that you're organizing, whether it's statewide or in your own community, um, and talking about your goals and your strategy and where they fit into that, right? And so you can have low sort of ask. Somebody could just start off by signing a petition or sharing a social media post, and then gradually, when they start to see some success of the campaign that you're working on, they want to do more. They want to volunteer more of their time, and so we call that, building ladders of engagement. So when people volunteer for something and say, hey, this is what I can do, and they're invested in it, what's that next step for them, right? What is that? Always kind of engage people with, talk to people about what they can engage with next. Next slide. So it answers, and this last one here answers the questions of how do we hold ourselves accountable to the shared goals that we set. When you're talking with your people, you already found your people, you found some organizations, you've come up with a plan. How do you keep things moving, right? It's one thing to have a plan, and it's another thing to implement it. And so sometimes there's a manager of like a specific task, right? So the person in charge of sending reminders, for people to take action, having different checklists or resources, setting specific benchmarks and milestones for actions. Like what is the total number of signatures on a petition, that you want to generate to the chief of police of your town on a certain issue, right? It's that, like, what do those milestones look like? And then when you set timelines, that helps it too, because people, we want to do this by June 15th, because in July this is going to happen, right? And so that engages people more, and gets that sense of urgency. And so next slide here. And so mostly kind of stick in that step 4 sort of mode of, strategizing, and coming up with solutions together with your state team. And so I just wanted to give a current example, from one of the states, of what they're working on right now, and how they kind of went through these steps. They kind of sometimes some of these steps are kind of combined in what people do, and that's okay. But that step 1 sort of assessment, and so this is in Virginia, what they're working on, LGTBQAI individuals, and access to housing, safe recovery housing, is a big issue out there. And so it was a big issue everywhere, but that's what they're working on in Virginia. And first they did that assessment. They identified a lack of resources. There is a lack of access for the LGBTQI community to recovery houses and recovery support services. And so it's something that when you do that community assessment, you say there's not a lot of this. That's a really easy assessment. And then they outreached and listened to people. So far they've held 3 listening sessions, and actually they evolved into solution sessions, and they have another one next week. And so there's actually 4 that have been scheduled, and organized. And what that did was it brought people in the LGBTQI community and allies together, to talk about some of the experiences they were having, to reiterate what they thought was in that assessment, right? There's a lack of something. And so that brought people into the process. They did a good job of bringing more people into the process. They clarified their goals, in terms of recovery housing, having safe spaces designated specific housing for that community, and then also developing safe recovery house standards for the LGBTQI individuals and to be adopted by their association of recovery residences in their state. And so they're very clear about the goals they're working to obtain together right now for this campaign. Next slide. And then they did a great job with strategizing for action because they held all of those sessions. And so ideas and solutions came out of those sessions. And so they created a work group around it. They figured out who they need to talk to make their goals possible in terms of the standards. There's a Virginia Association of Recovery Residences. That's who can help. That's who they're working with to make this a reality, right? There's a seat at the table strategy. The Virginia Association of Recovery Residences has a board. A RAP member is joining their board, right? So having people with lived experience seat at the table in the decision making. Research and drafted potential safe standards. They looked at some other states that had standards for LGBTQI in Ohio, right? They found some in some other states. They have a petition of support going. They're doing outreach to organizing partners. There are other organizations like Virginia Equality that would jump on this too. And so there are other organizations that are with RAP on that. They did a fantastic job there. And then they're organizing partners. They're going to kind of get into the mode of asking them to do different things, different asks. Maybe they'll share the petition on their Facebook page, for example. And then they need to keep people mobilized and engaged in it. Meet on it consistently. Communications and actions. Nathan, thank you for putting the petition in the chat. And so if people want to sign on and support LGBTQI initiative for recovery residences in Virginia, Nathan just dropped that action in the chat. And so he's strategizing, and then he's showing you what you can do. He's asking you, he's making an ask right there. So next slide. And so Virginia RAP's just done a tremendous job, just because, you know, a lot of states their legislative sessions are out of session, right? Or they're coming to an end. And so, okay, we need to start thinking about some of these community-based solutions to what we're hearing in the listening sessions. And so what we're gonna do, we're gonna do breakout groups for 15 minutes. And what you're gonna do in those breakout groups is you are gonna work as, you know, your breakout group is not gonna be other people from your state. It's gonna be randomized. But the scenario is that you are all on the same state team. And so what you're gonna do in those 15 minutes, and this is based on Tennessee, the Tennessee team right now. So you're going to be a part of a RAP state organizing team. You already held 2 listening sessions, and employment has come up on both of those sessions from many of the attendees. And so it's becoming really obvious that the main priority that the grassroots community wants you to work on is around employment. And so attendees have mentioned a number of issues around employment, like criminal records, not knowing where to start, a lack of like career paths, like not just jobs, like careers, right? Low wages. They've talked about transportation barriers to work, lack of recovery-friendly workplaces. Some people need help with interviews, building resumes, you know, like job skills. And so there's all of that kind of lying out there, right? And so you're going to work with your state team and your group, and you're all going to be a part of the state team. And so and as a team, you've decided this will be the primary focus for the next 4 to 6 months, just for example. You're dedicating the next 4 to 6 months to organizing primarily around employment issues in your state. So you're going to work with your team to come up with a list of potential strategies, messaging, and actions that can speak directly to solutions around the issue. And so what are you working towards, right? You know, what is the end, what is the main goal, and how do you get there? Whether it's media strategies or events or petitions, or you know, how do you work with recovery friendly employers, right? Like there are a number of different things that you can kind of come up with and work with your team on. And so Before we break into groups, I just want to put a few reminders. Next slide, real quick. Try to stay in solution mode as much as possible. It's really easy to, and this happens on a lot of state team calls. Like we dive into like what the problems are for a long time, and then all of a sudden we haven't really talked about any solutions or actions to it. And so just just keep these in mind when you're in your groups. You know, are the solutions that you're thinking about enrolling others in the process? Are they reaching hard to reach areas or populations? You know, what about populations that are coming out of prison and re-entering society, right? Are the solutions centered around marginalized individuals? Is the message clear? Do you need to reach out to other organizations? You know, is it a coalition thing? And just kind of think about how you'll measure progress. You don't have to answer all these questions, just keep them in mind while you're coming up with your list of solutions. And so each team gets 15 minutes. When you get in your group, we need one person to volunteer to be the recorder of the ideas, and then that person's going to report back in the main room when we come back in 15 minutes.